Welcome to Health Talk. Today we're going to talk about healthcare and who pays for it. We have with us today myself, I'm a physician, and Dr. Augusto Bastidas, who is Chief of Surgery at El Camino Los Gatos and El Camino Mountain View. And we've been colleagues and friends, and we're going to talk about the healthcare issues in America today and how we're going to pay for it. Is it affordable? So we came upon this topic because we as doctors are impacted and we have to take care of patients every day thinking about this. So tell us about your most recent experience about, let's say you're an outpatient with a 80-year-old having a transient ischemic attack, a mini stroke, coming in as an outpatient to the emergency room.
Well, thank you for the invitation today. I think that this is a very important topic because, as you hear every day in the news, healthcare is a big issue. And the main issue is that it has become unaffordable. If you look at the graphs, all the economists show you, healthcare just keeps increasing and increasing, disproportional to anything else in society. And so everybody is struggling to try to figure out how to pay for that. And I think the bottom line is that this society doesn't have the money to be able to pay for it at the rate that we've been increasing healthcare. And so everybody is trying to position themselves to figure out how to cut cost. And so the example that you asked me to comment on, I think, is just one small example of how Medicare has been changing some of their practices to try to cut cost. Now, traditionally, a Medicare patient has the reassurance that if they go to the hospital, their medical hospital bill is going to be covered pretty well from Medicare. Medicare has always done a very good job of taking care of our seniors. Recently, Medicare has started playing games with defining what is inpatient care. So Medicare covers hospitalization, which is inpatient care. And so most people would assume that if you go to the hospital and the doctor tells you you have to spend a night or two in the hospital, that that's inpatient hospital care. Currently, however, Medicare has created these new rules to define and limit who actually gets labeled as inpatient care, which changes their benefits as Medicare recipients. And so there are many conditions where doctors feel that it's most appropriate for the patient to spend a night, sometimes 2 nights, under observation to try to figure out what the diagnosis is or to make sure it's safe to send them home. And that condition or that situation is called observation or short stay. It goes by a number of different names. And that is treated very differently by the insurance companies and by Medicare. And specifically, medications that are given while you're under observation status are not covered the same way by Medicare as they are for inpatient. So if I admit you for an inpatient stay, your medications get paid as part of the inpatient bill by Medicare if you're a Medicare patient, right? But if I admit you just overnight and you have 10 medications you're used to taking, and the hospital provides you those medications while you're in overnight, all of a sudden they're going to send you a bill for all those medications at generally several-fold the cost of what it costs you to go buy it at the pharmacy. And so that's just one way that Medicare, I think, is trying to cut costs because Medicare is going broke.
Now, one of the problems is that, so let's say my mother goes in the hospital, she's 90 years old, and suddenly for a mini stroke, instead of just thinking that's all going to be covered, my mother will then have a bill of $1,000 for medications.
Exactly.
And that would be a shock.
It's a huge shock. It'll give her another stroke. And so this is becoming a big problem. And this is just a small symptom of the fact that that Medicare doesn't have money to support the healthcare demands of our seniors. But it's a bigger issue. This is not just an issue for seniors. You know, the overall cost of medicine is been increasing and increasing, and there are multiple reasons for that.
Now, there's another instance also. Let's say you look look on the internet and say, I have this pain in my abdomen. So the internet has made it a great equalizer because people are educated, they can look up their signs and symptoms, and they can go on Google, and then they go to a physician like yourself, a general surgeon. They decide, I'm just going to go see a general surgeon, and they find you. And now the expectation is, we'll fix it. Here we are in California, in Silicon Valley, and there are many engineers who says, what do you mean you just can't fix it? So there's the expectation in, currently, that we should be able to fix all to a very high level of return of function. And that costs money, it adds testing, and there's also, all doctors are aware of the environment that we have to practice the best way possible given the risks and benefits of waiting and not doing and doing it now. Tell us about that.
Well, your scenario touches on just about every aspect of what we need to discuss. And unfortunately, we don't have an entire day to discuss this. But let me try to break that down. So the first thing you said was a patient goes to the internet and gets some information.
I have pain in my abdomen.
Yes. I think that's wonderful. And what's also wonderful about this country is that they then have the freedom to choose to find a surgeon. It's not actually an efficient system. Seeing a surgeon for a tummy ache that might be from constipation is a pretty expensive way to get your constipation diagnosed. In countries that have better organized primary healthcare systems, where everybody has access to a doctor, you can provide a more efficient healthcare by making sure everybody has access, and not expensive care of everybody going to a specialist for a different part of their body. So that is one thing that contributes to costs. And so during my training, I had the privilege to work in the National Health System in England. Now, most people say, oh, the NHS, National Health System, socialized care, that's a bad system. And I tell you, I found it very efficient, very good for the patients. They provided excellent care with, I think, equivalent outcomes to what we get here at a fraction of the cost. Now, how are those systems different? And although they have a nationalized system, they also have a private system on the side. And if you look across the world, just about every country, Canada used to be one of the last that had a true single-payer system, and now they've broken away from that. So virtually every country that has a government-sponsored, organized healthcare system also has another system on the side. And what that does is it provides basic health care to the population. Granted, to be able to do that, there's probably going to be stuff that basic health care doesn't cover. And then for people who want to spend a premium to get that extra health care, they can get it on the private side. Now, by necessity, this is creating a two-tiered system. And this society, at one level, doesn't feel that you should have a two-tiered system. That's unequal. That's un-American. I actually wrote a paper on that when I was in college decades ago. And I was pretty naive to think that that alone was the reason it wouldn't work. But it's much, much more complicated than that. I think that the single-payer system, to keep things affordable, is going to have to ration healthcare. And rationing healthcare is something that no politician will discuss in Washington, D.C.
Because they want to get reelected.
Absolutely. Take a look at what happened with Obama. While he was having the initial push for healthcare reform, there was a recommendation from the U.S. Task Force on Cancer Care about when women should consider mammography. And that report came out, and that report actually was based on old data, and it suggested that maybe women shouldn't get routine mammograms until age 50, whereas in the past, the practice and recommendations of many societies, including the American Cancer Society, is that women